Hi, everyone. Welcome to a special segment of the Cancer Litter podcast celebrating Black History Month. This episode features Joni D. Nelson, Assistant Director for the Office of Workforce Development at the Medical University of South Carolina Hollings Cancer Center. Nelson is interviewed here by Robert A. Wynn, Director and Lippman Chair in Oncology at VCU Massey Comprehensive Cancer Center. Wynn is also the Cancer Litter's editor for Black History Month. In this episode, Nelson tells us how her background led her to pursue research that meets the needs of her community. And with that, I will leave it to her. Enjoy the episode.
It is good to have you, Dr. Nelson, with us today. This is getting to the close of our celebrating of Black History Month. It has been, a really amazing month for us of reflection about not only the recalling of our history, but also looking ahead. It's in that context, Dr. Nelson, that when we were thinking about people to invite, particularly young people on the come up, your name came up multiple times, and I think rightfully so. So, I know that you're doing amazing things at the Hollings Cancer Center at MUSC, that's in South Carolina. But I would like for you to start off with just telling us a little bit about yourself, but more importantly, once you tell them, why are you, of all the possible things you could be doing, girl, why all of a sudden are you, giving your life to research? But we'll get there in a second. But if you could just tell me a little bit about you, where you've been, and who are the influences in your family of getting you to where you are right now.
Sure. So first, thank you, Dr. Wynn. I love this segment. I think it's wonderful what you described to kind of future different folks that are, as you say, on the come up. So I appreciate that. But I think one of the things that is holding my attention right now are all things related to workforce development. So that kind of brings me to the space that I'm in now. So I was trained as a public health researcher. I had my master's was in biomedical science. So I kind of blended and fused those two together in the work that I have now. So I do a lot of work in rural health communities, utilizing a lot of public health aspects and interventions. We have an opportunity to improve rural health access with a variety of different foci for our research: head and neck cancer literacy, oral health. We do a good bit of cardiovascular work on my team, and that is within the Division of Population Oral Health at the College of Dental Medicine. But my prime time and fun partnerships and collaborations are with the Cancer Center, and that's where I dutifully serve as the Assistant Director for the Office of Workforce Development.
I got that. So as we talk about development, now listen, did you always say, pursue that I'm going to go to college, I'm going to get a PhD? How did that road look?
I absolutely think that was the nurturing of my support system, which was directly influenced by my father, military for over 22 years, major in the Army. My mother was registered nurse, BSN, and she actually graduated from the Medical University of South Carolina. And we can't see this on the podcast, but behind me in this direction is a certificate of achievement and contributions to the Medical University of South Carolina for 16 years, which is my meme. So that is my mom's mom. So I'm standing on the shoulders of two giants, one beginning without a degree, focused on contributing to the community here, my mother as a nurse, and then here I come many decades later, contributing to the field of science and cancer. So those are my influences, but I've always had a focus at an early age, primary school, around health and science. I think my collegiate years really pushed me forward. As a part of my sorority and Alpha Kappa Alpha Sorority Incorporated, I was introduced to a lot of different mentors, and more specifically, the legacy of other women leaders inside of science, outside of science. But Dr. Jewel Cobb specifically had a hold on my understanding of, I really can make this work. I can do public health. I can do cancer. I can do advocacy for healthcare access. And I think those experiences shifted my focus from clinical to community impact, and that really did a number on my professional path.
I am so glad, and we're going to lean in a little bit into two of the things you said. The first is there is sometimes in this field an idea that as particularly African Americans, that we are the first generation of. What I loved about what the story you just told us a little bit about yourself and the team to get you there is that you stand on the shoulders of people who have laid the foundation. So as we're talking to other young people, and particularly young people in middle school, high school, undergraduate, medical school, graduate school, I think that the importance of having that foundation in your family, I think is really not unique, but it's a story that we need to tell more. But I do have a question for those folks who may not actually have that rich family history as you have and been the benefactor of that. How do they build community?
I think building community starts from a passion. So in my case, I definitely had a village, but there wasn't anybody doing research. It was, you should be a nurse like your mom, or you should be a pediatrician, or you should be a dentist for that matter. And so
Mm.
I think building community in your passion area is critical as early as seen fit, right? So I started out with these different ideals around clinical careers, and then I had this pivot once exposure to other mentors and other organizations really provided the environment for me to feed on. So I think starting that community, it starts with curiosity. It starts with using the assets around you. If there's a pre-health organization, or there are folks in your church that might have some sort of access, it might not be direct access to someone, but they know somebody that knows somebody that knows somebody. And so that's always a great start. And it only takes one small seed for it to really grow into something pretty big, and it can launch you and propel you in a situation where you really get a hold of your final passion. So I think
You know,
community is huge.
I really love what you just said. And the issue of the passion, but you're recognizing that, since the 60s, we have developed networks.
Yes.
One of those that you pointed out, though, was the group, as you said, of women who've had impact and influence in your life. And so could you, lean into that a little bit more and tell us, you talked about Dr. Cobb and others, but who have been some of the major influences? And in fact, what we're recognizing is that that they may be African American, but they may not. So could you talk a little bit about that?
Absolutely. I obviously mentioning my soror, Dr. Cobb, but I do want to point out a few other folks that have been extremely influential. Number one, my mother, dedicated nurse, first continued to pour into my interest in science and medicine. She has a huge compassion level. I've witnessed her go from mom to nurse in 30 seconds, all while raising three daughters, military wife. So there's a resiliency there. I also know that my maternal grandmother, we call her Meme. She has since passed, but despite her third grade education and limited literacy in all aspects, not just health literacy, her exemplification of I'm not going to give up because of this thing has shown me that when you nurture a path for yourself and others, even though there are barriers, it is still possible. We can still change what's possible. Now that's tagline for MUSC, but that definitely applies here, sir. But there is definitely an opportunity to change what's possible. And dare I say that my mama and her contribution of years here, she made that a tagline before it was a tagline.
Mm.
So I believe that my pursued work in public health, advocating for healthcare access, workforce leadership, and my research that propels an opportunity to keep people healthy, all while promoting well-being, really aims to propel the field of science forward through creating opportunities for people to thrive in science and medicine.
Now, you had said something about and I'm really fascinated. And so I'm going to dig a little bit deeper. You had the opportunity just to be a care provider, like me and
Fair
like
enough.
many others, right? Yet you chose the field of research. And I
Yes.
want to dig a little bit deeper. Why? Because, was it just that somebody else did it? Did it just look good? Was it just a big question that you had burning that you were like, this is not being answered. The only way to do this is do research. How did you get to the research component of what you do?
Absolutely. So I started out in that clinical track. I had a lot of great exposure. I found myself working in a research lab, doing a good bit of things around periodontal disease and its
Mm,
outcomes in animal model research.
mm,
And I spent a lot of time with my maternal grandmother, my meme, and we had an incident where I accompanied her to the dentist. And in that exchange, and her 76-year-old self, she had an exchange with the front office person, and we were going through numbers and we were going through a care treatment plan. And I realized in that moment that my meme, who was always superwoman, had some limitations to her cape. And so from that, I realized I've got to switch a different knob now. And
mm,
that I've always had an interest in science and clinical care, and I was kind of teetering. And I think that propelled me to say, Joni, you understand the science and you understand the health outcomes, but there is an in between there. And
mm.
there is an opportunity for you to fill a gap for those who have access, but still may be limited in their quality of receipt. And there's an opportunity to create a research line. Thereby, we can create pathways where we can cultivate not only an opportunity to meet community needs, but also cultivate another generation and a cohort like myself to do so.
So you know what I love what you just talked about in the context of the academic framework of essentially what health delivery systems are and health implementation, and part of that is the workforce delivery. I was going to ask you, we're going to change gears a little bit. I was going to ask you a little bit before we change gears, though, about you have talked about you say AKA you want brought it up. You know what's up with that. So now we're going to talk a little bit about it. The Divine Nine. As you think about the history of those sororities and fraternities, those African American, for sororities and fraternities, they were important to people like MLK, Martin Luther King Jr. They were important to many people. But what role has the Divine Nine? And could you tell us a little bit about not only the Divine Nine, but their impact in the field of health?
Absolutely. So I'm going to speak from my experience with Alpha Kappa Alpha Sorority Incorporated. I must say the first and the finest, but
I,
I
I
have
knew
to
that. I
include
was
that.
waiting.
It's a necessity. It is
Listen,
a
I was
necessity.
waiting. I was
The,
waiting for
the,
that.
the only original. So I will say that from my membership, which will be 20 years in 2027, I will say that the access, the delivery, the integrity, and the structure of our sorority is vast and wide. So it goes across multiple disciplines, whether it's health, whether it's economic, whether it's business development, whether it's international. And I think because of those strengths in those connections, we have created a safety net inside of our other brothers and sisters, whereby we can push out doctors and leaders who are, the tops of the National Science Foundation, the National Institutes of Health, the National Academy of Science and Medicine. And I think because of those networks, little Joni and little Rob have access to some of these huge leaders to create pathways for those that are behind us. And so I think that the opening of such illustrious organizations have created a foundation for us to consistently thrive over time.
I love what you said, and those organizations, I think sometimes um, are not really given the weight of their impact throughout the United States of benefiting all people because you do have some of the leaders. So in thinking about leaders and in thinking about your roles, now in your roles, at MUSC and at the Hollings Cancer Center, you play leadership roles. So, what drew you to leadership, and what particular do you think either skill set or some that extra something special do you bring to your leadership roles?
Absolutely. I think what has always drawn me to leadership is to sit in a place of influence, not necessarily power, but influence. I talked about earlier creating pathways for healthcare access, opportunities for new and innovative research. And I think these leadership roles that I am sitting in, although earned, um, have an opportunity for critical path decisions, whether it be workforce, whether it be research intensive, whether it be new pathways to sustain our faculty, our staff, or to retain our trainees to come back and continue to work with us. I believe that is a passion of mine to create a community that keeps growing beyond my tenure. I think that the Cancer Center has a unique space in my heart because of those who we have known that have been impacted by those diagnoses, but even more so for myself, I'm a country girl. So I have a context and an understanding of what community looks like in our communities that are not geographically placed next to the biggest clinical site. And so I think that here am I understanding the context, having been trained as a scientist, and there's an opportunity for me to contribute to leadership which may otherwise be missed.
And what you said, which I really like, is that your research is certainly something that you're passionate around workforce development. But what I heard you say is that rural communities, whether, independent of where they are frequently
Absolutely.
have some of the worst health outcomes in the United States.
And
And so whether you're in Kentucky or whether you're in West Virginia or whether you're in North Carolina, South Carolina, we know that that is a national issue. So the quick question I have is, how would your focus on that aspect of rural, how do you sort of see your contributions to it? And the second follow-up question that before I even get to it is going to be, why the focus on rural? Because there are multiple communities. Why the rural community in particular? So maybe you want to start with why the rural community, and then tell me what your project or what your focus is going to do to try to help reduce that gap and improve the health of rural communities.
absolutely. I think why rural community, my question back is why not? We have already seen in evidence-based literature that populations of high need in many different gamuts, whether it's oral health, whether it's cancer outcomes, whether it's chronic disease management, we have seen our high need and rural communities are often in places of health professional shortage areas. Those geographic maps are in alignment. We also know that the dissemination is oftentimes at a slower rate for some of those innovations. We're seeing a lot of AI tools being used. We're seeing a lot of interventions being placed. And we know that the slower pour into some of our communities of high need and in rural areas create this gap and outcomes as it relates to lots of different health outcomes, specifically cancer. And so one of just the highlights of one of the projects that we are prioritizing is the Initiative for Clinical Trials and Education. So we always have a priority of ensuring that the best interventions, the best efficacy in drugs and other resolutions for patients with cancer diagnoses, that those needs are being met with the highest quality treatment. What we have been thinking about is understanding the workforce to supply that need. And that's thinking about the exposure of clinical trials and education, particularly in hidden spots that we don't always think about. And for South Carolina, one of our priority areas in training that workforce is technical colleges. So our technical colleges in our state are just beautifully aligned with a lot of our regional health networks, which creates an opportunity for a trained workforce to rise up to be able to meet the need of clinical trials occurring, increasing accrual, and creating a natural communication between community members as leaders, homegrown individuals in that workforce, to create these opportunities for recruitment for clinical trials in their local areas, especially our rural communities.
That's fantastic. And so I want to lean in a little bit because you said something, and again, you're too humble to sort of say it. You are part of an inaugural group, an amazing group, called the ELAC, other stands, for Executive Leadership Academy for Cancer Centers. Can you tell me, one, it was clear that I can see exactly why you were picked to be one of the upcoming leaders of tomorrow. But can you tell me what that program, a little bit more about the program, and what you think you've learned through the program to make you, hopefully, skills to make you a better leader?
Absolutely. So our ELAC fellows program has been I think a sentinel pivot for me, just personally, for my leadership training. It's an 18-month intensive leadership academy in partnership, obviously, with VCU, 6 on each side. So we're not alone. So we have a cohort. It's the first of its kind with these in-depth trainings over a period of time where we are literally being trained step by step on understanding the leadership characteristics of cancer center directors, leaders, program directors. It's a true game changer for someone like myself who has been exposed and trained in lots of leadership skills. But the understanding of all aspects, such as things like all aspects of the Cancer Center Support Grant, that P30, understanding the federal funding compositions, creating a matrices of what that would look like if we were running it as a simulation, giving us one-on-one skills on how to better improve our leadership skills through things like Leadership 360. Having a one-on-one mentor and sponsor has been one of the biggest and significant influences, I would say, at this stage in my leadership preparation. And so I think we have received a litany of content around cancer centers, all the way from pivots from programs to advance diversity to what does your data 2 table look like? Dr. Wynn, if I have to see that table one more time, I've been dreaming of it. That is how entrenched this program is. And so these pieces all are thread together they're weaving us together to not only be individually prepared as leaders, but how to work on a leadership team. And I believe that all of those aspects are definitely not only going to be a part of my toolbox, but at the forefront of my toolbox as I move forward.
Thank you for reflecting on that. I will say that, I always say that in the Olympics, we see numbers of people that they have core things that they all have to do as athletes. And so that's like leadership. They're core leaderships. But if you want to be specific about ice skating and figure skating, or specific about doing the pike, or specific about doing a certain event, you have to have specific training. But I think that you're reflecting, and you are a great, I think, amazing reflection of this new trend of saying leadership is like being an athlete. You have to be in condition. There's lots of things you have to do. But for your specific event, to actually have specific training around cancer centers, I think is something that is wonderful. So I know we're coming to the end. So I'm going to answer you a couple of questions. I hope you're ready.
I'm ready.
All right. So the first question I have for you is, being reflective of this month, if you had to name one, doesn't really matter who, they can be in the field, not in the field, but who would you say, in reflecting of Black History Month, is one of the people that have had the most impact on you? And it could be a historical figure, not a historical
Or
figure.
it could be not.
They could be African American, not. But if you think in reflecting on the impact of Black History Month, is there someone who stands out for you who's been a major impact player for you?
Yes, absolutely. And the reason why I'm prioritizing Dr. Carter Edwards, Dr. Lori Carter Edwards,
Come on now.
she is Associate Dean for Community Engagement and Government Affairs at Kaiser Permanente Bernard J. Tyson School of Medicine. And Dr. Lori Carter Edwards is the epitome of excellence. Okay, so let's start there. She is the epitome of excellence in her field. She has had a huge influential permanency on my understanding of leadership, understanding public health leadership, and understanding the governance of what it looks like to interprofessionally collaborate. And the reason why she is that I've spent a little over this last year of her involvement with the Evidence Academy, which we hosted this past fall at the Hollings Cancer Center. And that Evidence Academy was focused on cancer workforce development, where we brought over 52 leaders across South Carolina to engage in strategies and next steps for what it would look like to build a retainable and a sustained cancer workforce across all different ladders of a cancer emporium, if you will. And so Dr. Carter Edwards, her CV speaks for itself, and it precedes a lot of what I have done. But I believe that her work, not only as a current ELAM scholar, not only as a director at Kaiser Permanente and a faculty member, and her work with national CTSA groups on community engagement, but her ability to structure bringing up the next generation, all while holding the torch forward, is unparalleled.
I think that's awesome. And thank you for giving that. I mean, to be honest with you, as you sort of say, her work speaks for itself.
Absolutely.
So, so in that vein, what brings you the most hope?
Absolutely. I think I'm encouraged, and I've stated this previously, but I think it's important for repetition here. I'm encouraged by the growing strategies for a cancer workforce. I think that there are new paths that will be taken. I think in my role as assistant director for the Office of Workforce Development in my cancer center, I believe that there's always an opportunity to strengthen the training, strengthen the education, recruit new talent, and not be remiss of sustaining the skilled professionals that we have. So I have a hope that we can continue to cultivate the next generation of healthcare leaders and create new pathways along the way, that not for the sake of creating new pathways and roles, but for equipping the evolving needs of our communities and catchment areas that we're serving.
Awesome. Last two questions. What's the message to the people in the future, to the people who you want to influence in the future?
You stumped me with that, my Dr. Wynn. I think that the message for those for the future is to not omit what precedes you. I think there's a lot of times where we can do millennial, we can do Gen Z, we can do Gen Alpha, we can do whatever cohort. But I think it is important to not omit what precedes us. I gave a lot of different names earlier who have influenced me, what triggered me into this career of science. And if we do not train ourselves to remember what precedes us, we are not going to effectively stand on the shoulders of those giants. And that should be a priority goal, to extend further than what their wings have done.
I love that. My last question to you is going to be, all right, we've talked about the message you've given to the people in the future. what is the message that you want the people who have actually those foundation builders for you? What do you want them to know about, your crew and your folk time right now on the come up?
Our my cohort on the come up with me, um, remain humble with a dutiful work ethic. If we are not humble, lest we fall. There are a lot of leaders that we are exposed to. And I know we got the new hotness and we're doing all the things that are super innovative. But I also think two things can be true at the same time. So I think as I remain humble, I also need to remain dutiful to those leaders who have been in those spaces. So that is what I would share with my fine cohort with me, who are at the whims of tenure and promotion and new grants and competitiveness,
Mm.
with NIH and creating new pathways for themselves, and new director roles and new direct reports. I would say to my folks to remain humble, knowing that there is help. Those who are in existing leadership roles, are not without struggle. And so it would be wise, if we understood the landmines that they stepped on so that we don't repeat.
You know what? That's great wisdom. And by the way, I think if you were giving that message to the folks who are, let's just say that they're a little bit more seasoned, this is the reason why I think the folks who come before you actually have a lot of hope in you and your generation of scientists, of leaders, of healthcare providers, because it is not true that there is a generation that doesn't care. What I see emblematic through you is one that not only cares, but is strategic and tactical enough to want to make impact, real impact on how people's lives are impacted. So listen, Dr. Nelson, thank you for joining us. And again, want to just say thank you to you and being able to be part of our reflection on this month in the context for the Cancer Letter, in our reflecting on the greatness, the promise, the hope, and just the connectedness to our Black History Month. So, Dr. Nelson, thank you very much.
You're welcome. Thank you.